Getting value for money in healthcare these days is an important issue, but so is getting money for investing in healthcare. We're at the INSEAD Alumni Healthcare Summit in London, and our next guest can tell us all about that issue. He is Andrea Ponti. He's the global co-head of healthcare investment banking for JP Morgan. Thank you for being with us, and welcome to INSEAD Knowledge.
Thank you. Pleasure to be here.
You went to JP Morgan from Goldman Sachs, where you were phenomenally successful, and you advised Glaxo Wellcome in their merger and several others. What kinds of deals do you see out there in the healthcare sector now, or is that heyday behind us?
I think when I started in healthcare, there were lots of medium-sized companies that needed to gain scale and gain capabilities that they didn't have across the world, and I think that that's happened. There were a lot of mergers, and I think now it's really a question of buying capabilities that they don't have in very targeted areas. So you see companies buying pipeline products, you see companies buying other businesses that strengthen their therapeutic capabilities and competence, and you will continue to see a lot of M&A because I think that healthcare is a changing industry, both in pharmaceutical, medical devices, and the provision of services, trying to tackle the increasing costs of delivering healthcare and the needs for payers not to continue to pay more and more and more to get the same kind of services, and is a big issue, and therefore companies will continue to adapt their model to provide better service for less.
As an investment expert, in which part of this would you make money? Because there seem to be an awful lot of roadblocks, increasing regulations, tougher to get things on the market, new diseases coming up all the time, escalating costs everywhere.
Yeah, I think there's lots of very exciting changes that are happening in healthcare. There's a lot of very interesting innovation that's coming through. The diagnostic industry is discovering more ways to help the pharmaceutical industry in identifying the right patients and delivering the right therapies to the right patient populations. I think there's a huge amount that can also be done in the provision of care. In some countries, like in the UK, most of the care is provided by public hospitals. In some other countries, it's provided by hospitals that are run by private individuals but are actually paid for by the government. And I think a lot of those hospitals can probably improve the quality of service and the efficiency of the service that they provide, and there's a lot of places where that's happening today. So actually there's a huge amount of change, and with change comes opportunity, both to make money and to improve services and the quality of the provision of health.
Now, when you talked to the conference here, you mentioned something about one would expect that healthcare investment or investment in healthcare is not necessarily very good because it's kind of hit its peak, and that with your next breath you said that in fact it had been outperforming the S&P, and that certainly biotech was doing very well. So which is it?
I think that the macro picture is one that means that the growth that we've seen in healthcare spending for the previous 10 years is probably not going to be replicated for the next 10 years. It was an industry where price increases were quite common, and where the payer, it is one of the few places where the beneficiary is different than the payer, who's different than the person who prescribes the medicines, and therefore that dynamic led to an increase in the use and in the price of medicines and of the provision of care generally, not just of drugs. So I think the macro picture means lower growth, if not at least flat growth. But within that sector, there's lots of things that are changing. The generics industry has provided much cheaper medicines for a broader group of patients and across a broader spectrum of medicines, and that's something that has seen a lot of growth, and some very successful companies making a huge amount of money and then reinvesting that in improving, again, the quality of the medicines they provide. So
Are there any companies or any particular sectors that you think are doing particularly well that you like, that you have confidence in?
Yeah, I think there's lots of them, and it's difficult to list them all. I mean, in terms of sectors, we mentioned diagnostics. Certainly biotechnology continues to drive innovation. Many of the large pharma companies continue to invest in very interesting pipelines that are going to see the light of day and change therapy going forward. I think in the hospitals, you see a whole new segment emerging in the emerging markets, with investors creating effectively a whole new sector in India, in China, in the Far East, in terms of hospital chains that are going to provide for the local populations in a way that they've never been provided for in the past.
Let me end by asking you for your outlook. The next, maybe so hard to figure out how far ahead an outlook can be, but let's say maybe 3 or so years. Trends that you see, kind of your outlook for the landscape of this industry?
Yeah, I'll go even further than the 3 years. I think if you look at healthcare in the next 10 to 20 years, it'll probably be very different than it is today. I think a lot of the companies that are engaged in healthcare have had traditionally a relatively narrow focus in terms of products or diagnostics or services, and I think you'll see a better integration of all of those components to provide overall outcomes, because I think the governments and other people who are paying for these services would like to have better outcomes, and they'll be focused more on the outcomes rather than on what are the individual components that achieve those outcomes. And I think in that sense, healthcare companies will work together more. There'll be more partnerships, there'll be more sharing of information, and the model will change a little bit.
So more partnerships rather than M&As?
I think M&A and partnerships are a feature both of how companies get the skills and the capabilities and the know-how that they need to succeed in a changing environment, and that's what you're going to see.
A very different environment.
A slightly different environment, yes.
Thank you very much, Andrea Ponti, for being with us on INSEAD Knowledge.
Thank you.